Do you want to come through now? We're ready for you. We're just in here.
The bone scan is essentially, we will inject a radioactive tracer which is specifically tailored to get taken up in the bones. Essentially the doctor will be looking for things like, it might be a fracture, it might be sort of some other bony diseases, it might be looking at loosening in a joint replacement. And really it's, what the tracer shows is it will show areas of the bones which are working harder to repair itself. So things like a fracture where the bone is trying to repair will get an increased amount of tracer uptake. And from that will show up on the scan and we'll be able to write a report to tell the doctor that we think there might be something going on at this point.
Right, that's fine, so if you just lie nice and still for us.
We give an injection and then 3 hours later we'll do a whole body bone scan. In some instances we'll also do a quick picture immediately after injection and then another scan 3 hours later. The reason that we have to wait is that it takes a little while for the tracer to be taken up into the bones. It's just physiological, it's the biology of our bodies. Mastoid bone scan takes approximately 20 minutes to acquire a whole body sweep.
Typically the patient will come in, lie down on the bed, the cameras will come down sort of reasonably close to the face, but it's still, the camera is open out on either side. And essentially what happens is that the bed will then just slide out from between the camera heads, and while it's doing that we'll be taking a picture of the full skeleton.
And it's stopped now so we can get you up.
You won't get the results on the day. What happens is the scan will be acquired by the technologists. The scan will be then given to the physics team who will then have a look at the scan, write a report and send that to your doctor, and at the next appointment when you're next due to see the doctor, that will then, they will then be able to give you the results then.
And your results will go straight through to your consultant, and then they should be there within a couple of days.